Dr. Wolski, we know that you're very experienced in workman's comp and in personal injuries, but what do you think? What sets you apart there? Not just from the treatment. Let's leave that alone for a moment. But in terms of, I talk to chiropractors, I talk to physical therapists, I talk to MDs, and one problem they all have is get the workman's comp, get the insurance, get those people to pay. Get the company the person worked for get insurance. Get them or their insurance to, fork out that money. And without that, those doctors can simply not treat the patients because it's understandable to a very high degree. But at the same token, you seem to be getting people from literally all over the country to come to you for two reasons. Get well and get accepted by the insurance in the first place, which is their right because they sign up for it. It's just the insurance finds loopholes of not to pay, and you seem to find reason to kind of block that loophole and get them to pay anyway. How do you do it?
Well, it's all governed by state laws. We get patients just what they're entitled to, and a lot of times they don't know they're entitled to it. We also work with workers' comp attorneys to help the patients get the benefits that they're entitled to by state law. We get their weekly checks going. We can do impairment ratings, which gives them a final settlement for their injuries. We can get their back pay working with attorneys. And this really helps the patients because they can put food on the tables and survive this injury.
Right. I mean, the injury is bad enough, but then at the same time, what goes with it is the financial loss. Now, you say you get that, and with no doubt you do. You wouldn't have the patients from across the country to prove that. But so, is your own company? Do you have actually people in your practice who are knowledgeable about that and who kind of do the necessary paperwork, or at least show the patient how to fill out the necessary paperwork, or somehow get the wheels into motion? How do you do it? What's the physical interaction there?
Well, we've got full-time case managers that help the patient, so they walk them through each step of the way, and we've got we know some attorneys who are very good at getting the benefits that patients are entitled to when they get injured. And we follow, we learn all the rules and regulations and, try to help the patients as much as we can.
Wow. So basically it's a matter of knowing. As they say, let's just say the rich and the poor, they don't have a different tax code. It's just the rich one usually know the tax code and thus this why they pay less. It's not that the tax code isn't there for the poor also. He doesn't bother knowing about it. And you bother knowing about all the regulations, all the entitlements for the patients and put them on paper, and thus you get your cases paid for.
Exactly.
Good. Well, patients should know that. People should know that. Never back off a fight, so to say. Go for it, and you more or less you will get what you deserve. And at the same time, you're good at treating patients. Well, thank you very much. That should shed some light on the story. Basically, just know about it. But of course, as patients, there's no way to know about it. That's not what we study. We have our own job. We have our own things to do. So not only do we not know how to stay healthy and have plenty of work to do there, but that's why we need help. And you have that help readily available, and then and get it done. It's wonderful. Thank you very much, Dr. Wolski.
Thank you.